For those who don't know, on March 1st, the Drug Enforcement Agency, aka the DEA, announced new federal telemedicine guidelines that roll back access to buprenorphine and Suboxone over telehealth. Right now, this is a proposed rule. We have until March 31st to comment and ask for changes. What the new rule does is limit a prescription for buprenorphine to 30 days when it's written over telemedicine. So someone can start their Suboxone treatment via telemedicine, but then the clock starts ticking. They'll only have 30 days to find and physically see a provider in person. Then they can tell them that they prefer to continue Suboxone over telehealth, and then that provider has to refer the patient back to the original telemedicine Suboxone provider. So before COVID, it was illegal to write a prescription for buprenorphine or Suboxone via telemedicine. It's because there was a law on the books called the Ryan Haight Act that was enacted after a young man named Ryan Haight died because he took some medication that was prescribed for him online. That was in 2008, before Zoom was a thing, and it's been the law of the land since. When COVID hit, the Ryan Haight Act was suspended temporarily with the public health emergency. So we always knew that when the COVID public health emergency ended, the Ryan Haight Act would be reinstated unless the laws were changed. Congress then asked the DEA to develop a special registration process so that companies like Bicycle Health and doctors like me could continue to practice telehealth medicine for patients with opioid use disorder. Unfortunately, the DEA didn't actually create a special registration process. Instead, they created this in-person requirement that actually makes it much more difficult for patients to stay in treatment. I don't know why the DEA created this in-person requirement. There's no medical evidence to support this requirement, zero. All of the research that has been done shows that Suboxone treatment done over telehealth works, and it works well. Here's a rundown of some of that research. Let me read from the CMS press release. Increased use of telehealth for opioid use disorder services during COVID-19 pandemic associated with reduced risk of overdose. Now I'm reading from the NIH website. Increased use of telehealth for OUD services during COVID-19 pandemic associated with reduced risk of overdose. From the British Medical Journal, BMJ Innovations, a peer-reviewed bicycle health study. Telehealth engages people in treatment sooner and demonstrates higher retention rates, significantly reducing opioid morbidity and mortality. The Journal of Addiction Medicine, fully virtual care models increase patient satisfaction and access to treatment for opioid use disorder. This is from the Journal of the American Medical Association, JAMA Psychiatry. Increased use of telehealth for OUD services during COVID-19 pandemic associated with reduced risk of overdose. JAMA Open Network, after the Ryan Haight Act was waived for COVID, quote, the share of opioid-related deaths involving buprenorphine dropped from 3.6% to 2.1%, end quote. The American Journal of Psychiatry, buprenorphine treatment for veterans with opioid use disorder increased as care shifted to telehealth during COVID. I can go on and on, but you get it. Telehealth, opioid use disorder treatment works. As quickly as I can because we're on video and we have short attention spans. Addiction is a disease of the brain in which the brain circuits have been fundamentally altered so that when someone is addicted to opioids, they experience terrible physical withdrawal symptoms when they don't use opioids, and their ability to resist urges or cravings for opioids is seriously compromised. It's as if the brain has been hijacked by this distorted brain circuit. It's much less about choice or willpower than we think. And most people who've never experienced addiction will have a harder time understanding this. Thankfully, opioid addiction has some very effective treatment options. One of these is buprenorphine, aka Suboxone. Buprenorphine is amazing because it eliminates withdrawal symptoms, it stops cravings so that people can start getting their lives back or simply starting over and entering recovery. The research is clear. Buprenorphine saves lives. It decreases the risk of returning to opioid use, of overdose, and death. But the research suggests that buprenorphine seems to work best if a person remains on it for at least a year. This is probably because a person gets a chance to build more stability and resilience in their lives. Plus, if they remain in treatment, they continue to get guidance from a healthcare professional and other supports to help manage their recovery and avoid relapse. Telehealth won't work better for everyone, but for most people, it does. Because for the following reasons, and this is according to the research from Rand in the Journal of Addiction Medicine, I'm just paraphrasing. Overall satisfaction. Patients like it better than having to get in a car or bus, take time out of their day to go to an appointment. Ease of use. Patients say it's much more convenient. Faster intake. Patients who've tried to get into treatment before have a hard time. With telehealth, you can usually start within 72 hours, which is critical if you're in withdrawal. And for a lot of people, after 3 days of being in opioid withdrawal so bad they're liable to return to illicit opioid use. Another reason is accessibility and acceptance. Finding reliable opioid use disorder treatment is difficult, especially if you live in a rural area or you work and have kids. And by the way, 80% of bicycle health patients are parents. 53% of them are working or are full-time parents. So convenience in terms of accessibility and acceptance matters. It also limits their high risk exposure. For many patients in recovery, being exposed to other people in active addiction or struggling with relapse, it can be really difficult. So telehealth opioid use disorder treatment helps them get treatment without having to go somewhere in person where they risk, being exposed to other people who are using opioids. Community of care. Virtual care is actually in a lot of ways more intimate. You're at home or in a safe, comfortable place, maybe the driver's seat of the car, instead of some stuffy exam room or a waiting room. There's nobody else coming in and out, no nurse. So it's very intimate. And good programs like ours at Bicycle Health have other supports in place that you can access from your smartphone. Again, you don't have to leave the house. You don't have to leave the kids. You can just park the car if you're driving. So for most people in recovery, telehealth seems to be light years more effective. We'll put a link to the Federal Register in the description of this video, but it's long. You can also just go to oudhelp.com, and there you'll find a link to the Federal Register where you can leave comments. It does require an email address, but you can choose to comment anonymously.